Monkeypox. It's a word we've been hearing more and more. In 2024, it's still a public health challenge. We can't ignore it. We need to understand it. We need to protect ourselves and our communities. This isn't about causing panic. It's about being informed. It's about knowing the facts. When we are informed, we can make smart choices. We can stay safe. We can help others do the same. Monkeypox spreads in a few ways, and understanding these methods is crucial for prevention. Direct contact with an infected person is one way. This includes physical interactions such as shaking hands, hugging, or any other form of close contact. Contact with their rash or scabs can spread the virus. The rash and scabs contain the virus, making it easy to transmit through touch. Coming into contact with things they've touched, like clothing or bedding, can also be risky. Contaminated items can harbor the virus for a period, posing a threat to anyone who handles them. The virus can also spread through respiratory droplets. When an infected person coughs or sneezes, these droplets can carry the virus to others nearby. This happens when an infected person coughs or sneezes, releasing droplets into the air. It's important to cover your mouth and nose to reduce the risk of spreading the virus. It's important to remember that monkeypox is not airborne like the measles. This means it doesn't linger in the air for long periods. Close contact is usually needed for transmission. Being in close proximity to an infected person increases the likelihood of catching the virus. Animals can also carry monkeypox. Certain animals, particularly in specific regions, are known to be carriers of the virus. In some parts of the world, rodents are known to carry the virus. These animals can transmit the virus to humans through bites or direct contact. Coming into contact with these animals can lead to infection. It's essential to be cautious around wild animals and to seek medical advice if bitten or scratched. Understanding how monkeypox spreads is the first step in protecting ourselves. Awareness and education are key to preventing the spread of the virus. Knowing the risks allows us to make informed decisions about our health. By staying informed, we can take the necessary precautions to keep ourselves and our communities safe. Monkeypox often starts with flu-like symptoms. You might experience fever, headache, muscle aches, and fatigue. These initial symptoms can be quite debilitating, making it difficult to carry out daily activities. Swollen lymph nodes are also a common symptom. They can be tender and painful, often appearing in the neck, armpits, or groin. These symptoms usually appear within a few days to a few weeks after infection. The timing can vary, making it important to monitor your health closely if you suspect exposure. The telltale rash usually develops a few days after the flu-like symptoms start. This rash is a key indicator of monkeypox and should not be ignored. The rash can look like pimples or blisters. It may start as small, flat red spots that gradually become more pronounced. It can appear anywhere on the body, including the face, hands, feet, chest, and other areas. Hands, feet, chest, genitals, or inside the mouth. The rash can be particularly uncomfortable and may cause significant distress. The rash goes through different stages. Observing these changes can help in identifying the progression of the infection. It starts as flat red spots, which can be easily mistaken for other skin conditions, then develops into raised bumps. These bumps can be itchy and uncomfortable. These bumps fill with fluid, then pus. This stage can be particularly painful and may require medical attention. Finally, the bumps scab over and fall off. This is a sign that the body is healing, but it can take time for the skin to fully recover. The entire process can take several weeks. Patience and proper care are essential during this period. It's important to remember that not everyone experiences all of the symptoms. The severity can vary greatly from person to person. Some people may only have a mild rash. In such cases, the symptoms might be less noticeable but still require attention. Others may have more severe symptoms. These individuals might need more intensive care and should seek medical advice promptly. Early detection is key when it comes to monkeypox. If you experience any of the symptoms, especially the rash, it's crucial to seek medical attention immediately. Your doctor can assess your symptoms and determine if testing is needed. Early diagnosis allows for quicker treatment and isolation. This helps prevent the virus from spreading to others. It also allows healthcare providers to monitor your symptoms and provide appropriate care. Remember, monkeypox can be mistaken for other skin conditions. It's always best to err on the side of caution and consult a healthcare professional if you have any concerns. Your health is worth it. Section 5. Prevention is key, safeguarding yourself and others. In this section, we will explore the essential steps you can take to protect yourself and those around you from monkeypox. Preventing monkeypox involves taking simple but effective measures. These measures are not only easy to follow but also highly effective in reducing the risk of infection. Avoiding close contact with infected individuals is crucial. This means maintaining a safe distance from anyone who shows symptoms of monkeypox, such as a rash or fever. If someone you know has monkeypox, limit physical interaction until they have fully recovered. This includes avoiding hugs, handshakes, and any other forms of close contact. Good hygiene is also essential. Practicing good hygiene can significantly reduce the risk of spreading the virus. Wash your hands frequently with soap and water, especially after being in public or around someone who is sick. Make sure to scrub your hands for at least 20 seconds to ensure they are thoroughly cleaned. If soap and water aren't available, use an alcohol-based hand sanitizer. Hand sanitizers with at least 60% alcohol content are effective in killing most germs. Avoid touching your eyes, nose, and mouth with unwashed hands. These are common entry points for the virus, and keeping your hands away from your face can help prevent infection. This can prevent the virus from entering your body. Simple actions like using a tissue to touch your face can make a big difference. Also, avoid sharing personal items like towels, bedding, or utensils with someone who has monkeypox. These items can easily become contaminated and spread the virus to others. By taking these simple steps, you can significantly reduce your risk of contracting or spreading monkeypox. It's important to be vigilant and consistent in following these practices. Remember, prevention is always better than cure. By being proactive and taking these preventive measures, you can help protect yourself and your community from the spread of monkeypox. Section 6. The power of vaccines, a shield against monkeypox. Vaccination is a powerful tool in the fight against monkeypox. Vaccines help our bodies develop immunity to the virus, protecting us from infection. There are two main vaccines that are effective against monkeypox. Your doctor can advise you on whether vaccination is appropriate for you. They will consider your risk factors, such as potential exposure to the virus and overall health status. Vaccination is particularly important for individuals at higher risk of infection. It's important to note that vaccines are most effective when administered before exposure to the virus. However, even if you have been exposed, getting vaccinated can still provide some protection or reduce the severity of illness. Section 7. A community united combating stigma and offering support. Monkeypox, like any other health condition, should not be a source of shame or discrimination. It's important to remember that anyone can contract the virus regardless of their background, lifestyle, or sexual orientation. Stigma can prevent people from seeking testing or treatment, leading to further spread of the virus. We must create a supportive environment where people feel comfortable disclosing their health status without fear of judgment. Education and awareness are crucial in combating stigma. By understanding the facts about monkeypox, we can dispel myths and misconceptions. We must treat each other with compassion and empathy during this time. Section 8. A personal story, facing monkeypox head-on. I remember meeting a young man named David who had contracted monkeypox. He was initially scared and unsure of what the future held. The rash was painful, and the isolation from being in quarantine was taking a toll on his mental health. But David's story isn't just about the physical challenges of the virus. It's also about the power of human connection. His friends and family rallied around him, offering support and encouragement. They helped him access resources and navigate the healthcare system. David's story is a reminder that behind the statistics are real people facing real challenges. It's a call for compassion, understanding, and a commitment to supporting those affected by monkeypox. Section 9. Staying informed. Your role in monkeypox prevention. In the age of information overload, it's more important than ever to rely on credible sources for health information. Stay updated on the latest developments regarding monkeypox from trusted organizations like the CDC and WHO. Your local health department is also a valuable resource for information specific to your community. Don't hesitate to reach out to them if you have questions or concerns about monkeypox. Remember, knowledge is power. By staying informed, you can make responsible decisions to protect yourself, your loved ones, and your community. Section 10. Our collective responsibility, taking action against monkeypox. Monkeypox is a public health challenge that requires a collective response. We all have a role to play in preventing the spread of this virus. By working together, we can protect our communities and overcome this challenge. Get vaccinated if you are eligible, practice good hygiene, stay informed, combat stigma, support those affected. These are the actions that will make a difference. Remember, we are stronger together. Let's face monkeypox head-on with knowledge, compassion, and a commitment to public health. Section 11, Monkeypox, in 2024, Awareness, Preparedness, Action. Monkeypox is a reality in 2024, but it doesn't have to control our lives. By understanding the virus, how it spreads, and how to protect ourselves, we can navigate this challenge. Awareness is key. We need to know the symptoms, understand prevention methods, and seek medical attention if needed. Preparedness involves getting vaccinated if eligible, having a plan, and knowing where to access resources. Most importantly, we need to take action. This means taking personal responsibility for our health and supporting our communities. Together, we can make a difference. Together, we can overcome monkeypox.